Good morning. Welcome to IRG Physical and Hand Therapy's Health Talk. I'm Ron Schakal with Shannon O'Kelly, president of IRG Physical and Hand Therapy. And Shannon, let's get right to it.
That sounds good, Ron. Let's do this.
Well, one thing we all have in common, we're born.
Yeah, that's true. Yeah, there you go.
And today our first guest is a special guest, Siri Larson Iverson, midwife and owner of Snohomish Midwives.
Yeah, Ron, I'm super excited to talk to Siri. You know, midwifery, as they call it. I mean, it's an old profession. Like you said, we have everything in common. We're born, and we've been born for a long time. We're going to talk about what it's like to be a midwife and services offered.
All right, here's Shannon and Siri.
Siri, welcome to Health Talk. How you doing today?
I'm great. Thank you.
Thanks for joining us here on Health Talk. We like to talk about health things. And one of the health things we like to talk about is talking to people that do different things. And you're a midwife and you work in midwifery. Is that correct?
That's correct.
All right. Tell us about your background. Tell us how you got interested in it.
Yeah, sure. Well, most midwives in my shoes have got through midwifery because of having babies themselves, and that was not me. I went to school, undergrad, for women and gender studies stuff and anthropology, and didn't ever think I wanted to be part of healthcare. And, it was becoming an adult and working out in the world that was like, how do I do this practically, in a practical way? I have a graduate degree in midwifery care from Bastyr. And so you can either become a nurse first and then go on to become a midwife, or you can just have a degree in something else and go straight into midwifery. So that's what I did.
Midwifery is like one of the oldest professions in the world. I mean,
sure.
Yeah, back in the day.
There's been midwives as long as people have been born, right?
Hey, there you go. That makes good sense. So what is your practice? Tell us about your practice. You have a midwifery practice in Snohomish, Washington here. Tell us about your practice.
That's right. My practice is called Snohomish Midwives. I am the new owner the past year and a half or so. It's been around since 2009. And we are a private midwifery practice. We do full spectrum prenatal, birth, postpartum care for families.
Why would a person look for midwifery versus maybe going traditional MD? And I know there's a lot of collaboration and a lot of connectivity, but I'm just asking, what kind of clientele are you dealing with?
Yeah, why choose us versus that?
Exactly, yeah.
Well, it's more personal care. We see birth as a very vulnerable family building time. To that end, we want people to trust us. We want it to be a relationship. We want to protect that aspect of it. So people who come to us, they want the extra time that we spend with people. We have hour-long prenatal visits in order to get to know our clients, to know what their preferences are, so they trust us, we trust them. That gives us lots of extra time for patient education, so that we can arm people with knowledge so that they can make truly informed choices along the way for their families.
Yeah, childbirth is a huge event. It's interesting. I like how you say, the experience that you're providing, and it's unique, and you're using medical research and information. I mean, this is not a grass hut, so to speak, where you're going out to. This is connectivity. Right. This is education. You're well trained. Tell us about that process from I find out I'm pregnant, and the process going through, and how you connect with your patients.
Yeah, we provide full holistic care. I care just as much about how people are doing in their mental health and their, nutritional health and their spiritual health as I do the physical body, because I know that all of that is really connected in how they are experiencing their pregnancy, right? And the health as a family and as a well-being. And pregnancy is such a hormone-driven thing that if you're not doing well in the rest of your aspects of your life, that can affect your pregnancy.
Wow. I so much appreciate the information. We are out of time, unfortunately, but boy, we need to have you back. I want to continue this conversation because this is just really fascinating stuff. So thank you for your time.
That was Siri Larson Iverson, midwife and owner of Snohomish Midwives. Back with more right after this on Como.